Missing a tooth? Now what? You are missing a tooth and you're trying to find out the best tooth replacement options for yourself. I'm Dr. Nate here at Thrive Dental Orthodontics, and I'm gonna walk you through the 3 options you have to replace that missing tooth. So number 1, starting with probably the most popular options, is to replace it with something that is very permanent. Now the 2 permanent options really are a dental implant or a dental bridge. I've done multiple videos on the differences between a dental implant or a dental bridge, but I'm going to give you a brief overview here. A dental bridge is when you prepare the 2 adjacent teeth next to the edentulous area. Typically what you do is you take an impression or a scan of that prepared area, send it off to the lab, and in roughly 2 weeks or so, you're gonna get that dental bridge, which is permanently cemented on your teeth. Now the advantage of this is it's typically more affordable than an implant. It takes a whole heck of a lot less time, and it can look really, really good. Now the other option is a dental implant. A dental implant is when the surgeon places an implant in your jaw structure. You wait roughly 2 to 4 months, and then after that, you're gonna get something called an abutment and then a crown placed on that tooth. Now the advantage of this is you do not have to touch those 2 adjacent teeth next to the edentulous area. The disadvantage of this is it takes a little bit longer and slightly more expensive than a dental bridge. You may also not be eligible for implants if you have poor bone in that area where the tooth has been previously extracted. Dental implants, if placed properly, can last a very, very, very long time. Now the second option is to do something called a flipper, or something very similar. A flipper is like a partial denture where the dentist actually takes an impression of your mouth, they send it off to a lab, and it comes back and it's something that looks kind of like a dental retainer, but has a tooth on that retainer. Now this is a very temporary option, and it's something that you take in and out. So some people will use it maybe for a few months or a few years, but typically they want a more permanent option after that. Now the third and least desirable option is to do nothing. Now you might think this is the most affordable option, but this turns out to be by far the most expensive option to do in the long run. Now the reason this is the most expensive option is because if you have a tooth missing here, the 2 adjacent teeth are gonna go into that area, and the tooth above it is also gonna collapse into that edentulous area. So eventually when you wanna get that tooth restored, you're gonna have to upright those teeth with either braces or Invisalign or some product like that. You're gonna have to also intrude the tooth above it and push it up, which sometimes is actually not even an option. So you may need to root canal this tooth, upright these teeth, and then put an implant. And now you can only imagine how expensive that is. That's probably triple the cost of what it would cost if you would have just done something more permanent initially. Now, just before I talk about pricing, when I'm talking about implant, there's really 3 main structures you should know about. There's the implant body itself, and there's the abutment that goes on the implant, and then there's the final crown restoration after that. Now for the whole thing, for the implant, abutment, and crown, it's gonna cost you anywhere from $3,000 to $6,000 on average. A dental bridge is gonna be quite a bit more affordable than that. It's probably gonna be anywhere from $2,000 to $3,000. And keep in mind with those 2 options, dental insurance is gonna play a massive part. There are many times with dental bridges that it's covered at 80%. So if it's gonna be $3,000, 80% of that's gonna be covered by your dental insurance. Implants may or may not be the same. Typically their coverage isn't quite as good as a dental bridge. And a dental flipper is gonna only be a few $100s, but remember, that's a very temporary option. And then lastly, if you don't do anything but you wanna do something later and you wanna get braces, you need to do endo, and you need to do a bridge, that's probably gonna run you maybe $10,000, $13,000, $14,000, $15,000. So you can see that the best option is to do something immediately and hopefully have great insurance that's gonna cover the vast majority of the cost. So now you know what the options are to do if you're missing one single implant. You know roughly the pricing. If you wanna know the difference between a dental implant or a dental bridge, check out this next video.